Hi, everybody. I'm Dr. Armen, Professor Armen Astvatsatryan from Yerevan, Armenia. We continue our job. So, my dear friends, my dear students, take pens, papers, and let's continue. Today's question will be about gastritis. So, a lot of points about gastritis. Uh, so, new angles in the management of diagnosis of Helicobacter of gastritis. I'm not agree, but it's not problem of me. It's how you have to answer on the exams. My point of view is not the same as I will talk in this lecture. Please remember that, I understand that. So my answers will be like the answers of a good student on the exam. Okay? Third time I said I'm not agree with a lot of points here. Okay, so gastritis. So, my dear friends, you take your pens, papers, good to make the notes. It's quite important for remembering and re-listening this video several times. Okay, gastritis. What is gastritis? Gastritis, as we understand the name is the inflammation of gastric mucosa caused by any of several conditions, including infection, Helicobacter pylori, drugs, non-steroidal anti-inflammatory drugs, alcohol, stress, and autoimmune phenomena, so-called atrophic gastritis. Many cases are asymptomatic, but dyspepsia and gastrointestinal bleeding sometimes occur. Diagnosis is by endoscopy. Treatment is directed at the cause, but often includes acid suppression and, for Helicobacter pylori infection, antibiotics. Okay, so answer like this is quite enough, but if professor or members of the jury insists, so I find another questions, we have to continue. Etiology. So gastritis etiology. Gastritis is a medical condition characterized by inflammation of the stomach lining. The etiology or cause of gastritis can be multifactorial and can vary depending on the type of gastritis. Okay, some common etiological factors that are associated with gastritis. Famous Helicobacter pylori infection. Fairy tales. So Helicobacter infection, there is the most common cause of gastritis. Helicobacter pylori is a type of bacteria that infects the stomach lining and triggers an immune response leading to inflammation. Non-steroidal anti-inflammatory drugs. Here I am agreed 100%. NSAIDs. Regular and prolonged use of NSAIDs, such as aspirin, ibuprofen, naproxen, can irritate the stomach lining and cause gastritis. NSAIDs inhibit the production of a protective enzyme called prostaglandin, which helps maintain the integrity of the stomach lining. Another point, excessive alcohol consumption. Alcohol can irritate the stomach lining and cause inflammation, leading to gastritis. Heavy alcohol consumption over a prolonged period of time can increase the risk of developing gastritis. Actually, smoking, I don't know why they don't talk about that, but smoking is most common provoke gastritis than alcohol. Several times faster. More frequent, okay. Autoimmune disease. Certain autoimmune diseases, such as autoimmune gastritis, can cause inflammation of stomach lining. In autoimmune gastritis, the immune system mistakenly attacks the cells of the stomach's lining, leading to inflammation. That's why it's autoimmune. Stress. Okay, yes, that's okay. Absolutely agree with that. So stress, prolonged stress, and emotional trauma can disrupt the normal functioning of the stomach and lead to gastritis. Stress can trigger changes in stomach acid production and affect the protective mechanisms of the stomach lining, leading to inflammation. Bile reflux. Bile, which produced in the liver and stored in gallbladder, can reflux back into the stomach and cause irritation of the stomach's lining, leading to gastritis. And several other factors. Other less common causes of gastritis include, for example, infection, viral infection, or bacterial infections other than Helicobacter pylori, radiation therapy, ingestion of caustic substances, and certain medical conditions such as Crohn's disease, sarcoidosis, and vasculitis. Well, it's largely enough, okay, for etiology. Next is the pathogenesis. Gastritis pathogenesis, no pathology, pathophysiology. The pathogenesis or the development and progression of gastritis involves a complex interplay of various factors that can result in inflammation of the stomach lining. The exact pathogenesis of gastritis may vary depending on underlying cause, but here is the most common general overview of the process. General view, consensus. Initial damage to the gastric mucosa. Gastritis often begins with some form of damage to the protective layer of the stomach lining, known as the gastric mucosa. This damage can be caused by factors such as Helicobacter pylori infection, unsafe use, alcohol consumption, or other irritants. Activation of the immune response. Another point. When the gastric mucosa is damaged, it triggers an immune response in the body. This immune response involves the release of various chemical messengers, such as cytokines and chemokines, which attack immune cells to the site of inflammation. Next point, inflammation and tissue damage. Immune cells, such as neutrophils and lymphocytes, infiltrate the gastric mucosa and release inflammatory mediators, causing further damage to the stomach lining. The inflammatory response leads to redness, swelling, and increased blood flow in the affected area and can result in tissue damage, and erosion of the gastric mucosa. Next point is disruption of the gastric barrier function. Threshold. The stomach's lining normally acts as a barrier that protects the underlying tissues from the corrosive effects of stomach acid. The stomach lining normally acts as a barrier, as a buffer, that protects the underlying tissues from the corrosive effects of stomach acid. In gastritis, the inflammation and tissue damage can disrupt the normal gastric barrier function, allowing stomach acid to penetrate deeper. Deeper, the inflammation and tissue damage can disrupt the normal gastric barrier function, allowing stomach acid to penetrate deeper into the gastric mucosa, causing further inflammation and damage. Okay? So once again, disruption of the gastric barrier function. The stomach lining normally acts as a barrier that protects the underlying tissues from the corrosive effects of stomach. In gastritis, the inflammation and tissue damage can disrupt the normal gastric barrier function, allowing stomach acid to penetrate deeper into the gastric mucosa, causing further inflammation and damage. Now it's okay? So, repair and healing. In response to the tissue damage, the body initiates a repair and healing process. This involves the activation of cells that produce new tissue, such as gastric epithelial cells, and the release of factors that promote tissue repair, such as growth factors. And chronic inflammation, last point. So, if the underlying cause of gastritis persists or is not adequately treated, the inflammation can become chronic, leading to long-term damage to the stomach lining. Chronic gastritis can increase the risk of developing complications such as peptic ulcers, gastric bleeding, or even stomach cancer in some cases. Classification. Gastritis classification can be gastritis can be classified in the different types based on various criteria, including the causes of inflammation, the location of inflammation, actually the severity of inflammation. Okay, let's go with some common classification of gastritis. Etiological classification. Gastritis can be classified based on underlying cause of inflammation. Some common etiological classification. Let's repeat. Some etiological classifications of gastritis include Helicobacter pylori associated gastritis. This type of gastritis is caused by an infection with the bacterium Helicobacter pylori, which is a common cause of gastritis. NSAIDs-induced gastritis, non-steroid anti-inflammatory drugs, gastritis. These types of gastritis caused by the prolonged use of non-steroid anti-inflammatory drugs such as aspirin. Now for me, I can't take neither aspirin nor ibuprofen, and neither naproxen, which can irritate the stomach lining and lead to inflammation. My example. Autoimmune gastritis. This type of gastritis is caused by autoimmune reaction in which the immune system mistakenly attacks the cells of the stomach lining, leading to inflammation. Chemical gastritis. This type of gastritis is caused by exposure to irritants such as alcohol, bile, or other corrosive substances that can damage the stomach lining and cause inflammation. The location-based classification. Gastritis can also be classified based on the location of inflammation within the stomach. Common location-based classification of gastritis include antral gastritis, antral, not anal, antral gastritis, inflammation that is primarily limited to the antrum, which is the lower part of the stomach, near the pylorus or pylorus, the opening that connects the stomach to the small intestine. Fundal gastritis, we talk about location. Inflammation that involves the fundus, which is the upper part of the stomach, fundus and antral. Diffuse gastritis, inflammation that affects the entire stomach lining, involving both the antrum and the fundus. Fundus, actually I don't know how to pronounce fundus, of course. If you pronounce fundus, up to you. Severity-based classification. Gastritis can also be classified based on the severity of inflammation. Common severity-based classification of gastritis include acute, chronic, superficial, and atrophic. Acute inflammation that occurs suddenly or it's a short duration. Chronic gastritis, inflammation that persists over longer period of time, often for months, even years, decades. Superficial gastritis, inflammation that is limited to the superficial layers of the stomach lining. Atrophic gastritis, inflammation that results in the thinning and loss of the gastric mucosa. Symptoms and signs. Signs and symptoms, clinical symptoms, signs. Some manifestation of gastritis. So, gastritis is a condition characterized by inflammation of the stomach lining, and it can present with a variety of symptoms and signs. The severity and type of symptoms can vary depending on the underlying cause and the extent of inflammation. Common symptoms and signs of gastritis may include abdominal pain. This is one of the most common symptoms of the gastritis. This pain may be dull, burning, or gnawing in nature, and is typically located in the upper abdomen, around the stomach area. The pain may worsen after meals or on an empty stomach. Nausea and vomiting. Gastritis can cause a sensation of nausea, which may be accompanied by vomiting. Vomiting may be particularly common in acute gastritis or when the stomach is irritated by certain foods or substances. Loss of appetite. Gastritis can lead, this is a protection, protection function. So loss of appetite. Gastritis can lead to a decreased appetite and feeling of fullness even after eating small amounts of food. Bloating and abdominal discomfort. Gastritis can cause bloating, gas, and general discomfort in the abdomen, often described as a feeling of fullness or pressure. Indigestion and heartburn. Gastritis can cause indigestion, which may present as a feeling of discomfort or burning in the upper abdomen, along with acid reflux or heartburn. Hematemesis or melena. In some cases, gastritis can cause bleeding from the stomach lining, which may result in hematemesis, vomiting blood, or melena. Melena is from another hole. So hematemesis with vomiting blood, melena with blood. Dark, tarry stools. Fatigue and weakness. Chronic gastritis, particularly autoimmune gastritis, can cause malabsorption of certain nutrients, leading to fatigue, weakness, and even anemia. In some cases, it's important to note that not all individuals with gastritis may experience all of above-mentioned symptoms, and the severity of and duration of symptoms can vary widely. In some cases, actually in the most of cases, gastritis may be asymptomatic and might be detected incidentally during diagnostic evaluation for other conditions. Just like discovery. Gastritis diagnosis. Diagnosis of gastritis typically involves a combination of medical history, or like in other conditions, physical examinations, and various diagnostic tests. Let's go. Medical history and physical examination. So we'll take a detailed medical history, including asking about symptoms, dietary habits, medication use, such as non-steroidal or steroidal anti-inflammatory drugs or aspirin, alcohol consumption, and any previous history of stomach or digestive issues. A physical examination may also be conducted to assess for any signs of abdominal tenderness or other related symptoms. Laboratory tests. Blood tests may be ordered to assess for specific markers that may indicate the presence of gastritis. These may include tests for check for the presence of Helicobacter pylori, infections such as blood test for Helicobacter pylori antibodies or a stool test for Helicobacter pylori antigens. Blood tests may also be done to assess for signs of anemia or other abnormalities. Endoscopy. Upper gastrointestinal endoscopy is a common Gestapo diagnostic procedure used to directly visualize the stomach lining and obtain biopsies. During endoscopy, a thin flexible tube with a light and camera endoscope is passed through the mouth into the stomach to visualize the lining of the stomach and obtain what? Biopsy, and obtain small tissue samples for further examination under a microscope. This can help identify the presence and severity of gastritis as well as rule out other conditions. Imaging studies such as abdominal X-ray, ultrasound, computed tomography scan may be ordered to visualize the structure of the stomach and surrounding organs, and to assess for any signs of inflammation or other abnormalities. Breath tests, yes, breath tests may be used to detect the presence of Helicobacter pylori infections, very fashionable now. These tests involve ingesting a special substance and then breathing into a container, which is then analyzed for the presence of Helicobacter pylori. Other tests, in some cases additional tests, may be ordered based on suspected underlying causes or cause of gastritis. For example, tests to assess for autoimmune markers in the blood may be ordered in suspected causes of autoimmune gastritis. So the specific diagnostic approach will depend on the individual patient symptoms, medical history, suspected underlying cause of gastritis. Oh, we understand. Next is differential diagnosis. So gastritis is inflammation of the stomach lining and can have various causes. The differential diagnosis for gastritis includes differential diagnosis includes other conditions that may present with similar symptoms or findings. Here are some common conditions that may be considered in the differential diagnosis of gastritis. GERD. GERD is a gastroesophageal reflux disease. So reflux is a condition, GERD, is a condition in which stomach acid frequently backs up into the esophagus, causing symptoms such as heartburn, regurgitation, and chest discomfort. GERD can cause similar symptoms as gastritis, including abnormal abdominal pain, indigestion, and acid reflux. Peptic ulcer disease. Peptic ulcers are sores that form in the lining of the stomach and duodenum, the first part of the small intestine. Like gastritis, peptic ulcers can cause abdominal pain, indigestion, and bloating. However, unlike gastritis, peptic ulcers involve damage to the deeper layers of the stomach or duodenum. Functional dyspepsia. Functional dyspepsia is a condition characterized by recurring or persistent pain or discomfort in the upper abdomen without any identifiable structure or biochemical cause. The symptoms of functional dyspepsia can overlap with those of gastritis, including abdominal pain, bloating, and indigestion. Gastroparesis. Gastroparesis is a condition in which the stomach takes longer than normal to empty its contents into the smaller intestine. This can cause symptoms such as bloating, nausea, vomiting, and abdominal pain, which may be similar to gastritis. IBS. IBS. Irritable bowel syndrome is a chronic condition that affects the larger intestine and causes symptoms such as abdominal pain, bloating, gas, and changes in bowel habits. Some symptoms of IBS can be similar to those of gastritis and may be considered in the differential diagnosis. Food intolerance or allergy, it's actually not the same thing, huh? Okay, but anyway, food intolerance or allergy. Some food intolerance or allergies can cause gastrointestinal symptoms similar to those of gastritis, such as abdominal pain, bloating, and nausea. Identifying and managing any food intolerance or allergies may be necessary to address the symptoms. Inflammatory bowel disease, IBD, including Crohn's disease and ulcerative colitis, are chronic conditions that cause inflammation of gastrointestinal tract. These conditions can cause symptoms similar to gastritis, including abdominal pain, diarrhea, and nausea. Other less common conditions, less commonly conditions such as pancreatic disorders, gallbladder disease, and certain infections, for example, viral gastroenteritis, gastroenteritis may present with symptoms similar to gastritis and may need to be considered in the differential diagnosis. Gastritis treatment. So management. The treatment of gastritis depends on the underlying cause, severity of symptoms, and individual patient factors. Medications. Medications are often prescribed to manage the symptoms and address the underlying cause of gastritis. This may include proton pump inhibitors. That depends how you pronounce it. Doesn't matter. So PPI, proton pump inhibitors. PPIs are medications that reduce the production of stomach acid and are commonly used to treat gastritis caused by excess acid production or Helicobacter pylori infection. Antacids are over-the-counter medications that help neutralize stomach acid and provide temporary relief from symptoms such as heartburn and indigestion. H2 receptor blockers are medications that reduce the production of stomach acid and may be used to manage symptoms of gastritis. Antibiotics are prescribed to treat gastritis caused by Helicobacter pylori infection. Why? They are typically used in combination with other medications such as PPI to eradicate the infection. Cytoprotective agents such as sucralfate that medications can help protect the stomach lining and promote healing of the mucosa. Prokinetic agents are medications that help improve gastric motility and may be used to treat gastroparesis-associated gastritis. Lifestyle changes may be recommended to manage gastritis, such as avoiding trigger foods, for example, spicy or fatty foods, reducing alcohol, caffeine consumption, quitting smoking, finally, of course, and managing stress. How you can manage stress. Dietary modifications such as eating smaller meals more frequently, avoiding irritant foods, and maintaining healthy diet with adequate fiber may help manage gastritis symptoms and promote healing of the stomach lining. Treatment of underlying condition. If gastritis is caused by underlying conditions such as autoimmune disorder or an infection, treatment of underlying condition may be necessary to effectively manage gastritis. Follow-up monitoring, regular follow-up is necessary. So what is next? Prevention. Actually the same thing, Okay, gastritis prevention. Prevention of gastritis involves adopting healthy lifestyle habits and avoiding risk factors that can contribute to the development of gastritis. Avoiding irritants, limit or avoid consumption of irritant substances such as alcohol, tobacco, caffeine, then this can irritate the stomach lining and contribute to the development of gastritis. Healthy diet. Maintain a healthy and balanced diet that includes a variety of foods, which emphasis on fruits, vegetables, whole grains, lean proteins, and low-fat dairy products. Fairy tales, Avoid excessive intake of spicy, fatty, and processed foods. Processed foods, yes, and as they can trigger gastritis symptoms in some people. Proper food handling proper food handling and hygiene. Practice proper food handling and hygiene to prevent foodborne infections, which can lead to gastritis. Wash hands thoroughly before handling food. Cook food thoroughly and store food properly to avoid contamination. Managing stress. Chronic stress can weaken the immune system and disrupt digestive process. Okay, potentially contributing to the gastritis. Adopt stress management techniques such as exercise, meditation, yoga, and other relaxation techniques, sex for example, to help manage stress. Medication use. Follow up prescribed medication as directed. Treatment. Treating underlying conditions. Yes. Regular checkup. No, it's a follow-up. Avoid allergens or intolerance. Limiting alcohol consumption. Finally, rehabilitation. Actually, everything is the same question. So, rehabilitation. Follow treatment plan. Follow dietary recommendations. Avoid irritants. Manage stress. Regularly follow up. And lifestyle modifications. Actually, largely enough, my friends, for your questions for gastritis. See you in another lectures. God bless you. Don't forget to follow and subscribe our channel. Bye bye.